My name is Tushar Singh. I won the Sheth Award in 2018. So in 2018, I was the country director for US CDC posted in Sierra Leone. So I was the country director for our CDC in the US, working in Sierra Leone. So, Sierra Leone, Liberia, and Guinea in West Africa had the largest Ebola outbreak in 2013, 2014, 2015, and 2016. So the health systems in those countries were devastated. They were already quite limited and challenged due to a lot of other issues, including a long civil war in those countries. And after Ebola, a lot of the health workforce actually died due to Ebola, and the health systems and economy collapsed. So CDC's goal was to actually support Sierra Leone in ensuring they can strengthen their health systems and their health workforce. So our main focus was on health security and making sure that these countries, including Sierra Leone, are able to strengthen those systems to be able to identify very rapidly any of these infectious disease threats and to be able to respond to those emergencies and prevent them going forward. So our main focus was in these two areas of health system strengthening and capacity development of the public health workforce. I think this award actually gave me some more understanding and insights into how some of the alumni who were international students actually had succeeded in their careers and had become leaders in their professions. And I had honestly never even thought about this, that how could a group of international students in one university, how their careers progress and how they actually become these kind of leaders. And I started reading about Dr. Sheth, and when I was nominated or when I received the award, and I understood that he was such a role model for people like me who came from another country, adopted into another country's systems, and how they were able to excel not only in their professional lives but also in other skills, in humanitarian skills, in assimilation within the society, and also learning about the generosity of some of these people on how they have contributed to not just the United States but also other countries internationally, in building systems and careers and economies throughout the world. So I think that was, first of all, that was very humbling, but it was also really a great model for me to motivate me to be like that as I grow. I got the Young Alumni Award, so I still have I hope at least a couple of decades, hopefully more, and that motivated me to work more toward this. So, again, I'm in public health. I was in charge of one of our country offices. Like after winning the award, I stayed there in Sierra Leone uh, through the first through the first phase of COVID-19. So I moved to Georgia in August of 2021. So for the first year and a half of COVID-19, I was still in Sierra Leone. And again, there were lots of initial worries that countries like Sierra Leone or overall in Africa, where the systems were still on the path to being developed, may not be able to cope with large outbreaks when we were seeing other countries in Western Europe and later on in the US, how how challenged we all were in all those other countries in managing COVID-19. So our goal was, to make sure that we have countries like Sierra Leone that do not have all those systems and that workforce to manage really large outbreaks be prepared. And that is what we had worked on before that. So we continue to work to make sure that these countries, like Sierra Leone, in my case, was prepared, and actually they performed really phenomenally because they had all this experience from Ebola. They did really great contact tracing investigations. We had trained a lot of people. While Ebola was managed by people like me, who at that time I used to work in Atlanta, and I used to go there to help manage the outbreak. It was managed by people like me who were international, but COVID-19 was managed by locals, by the public health professionals. So we continue to work toward that to make sure Sierra Leone and countries like Sierra Leone were able to actually build their capacities to manage these outbreaks. And we saw the benefits of our programs through that work. Now, the again, one of the things, I was reflecting on this as I was thinking about this interview also, on how uh, some of these exposures, and working with people who have gone through these kind of careers, where you have opportunities. Like, I consider this an opportunity for myself, who comes from another country and was given an opportunity to study and grow in the US as well as in other countries, how to utilize it more and what has served me best. And I wanted to continue growing while there were opportunities in Sierra Leone to continue supporting it. I was looking for a bigger challenge. And my passion is building workforce capacity. So, uh, so there was an opportunity. CDC moved toward a regional model where we started developing these regional offices. And so while we have country level offices and we have headquarters support, there was a middle level of regional offices that was designed and established. And there was a position for a workforce advisor for one of the regional offices. So it's in the Eastern Europe and Central Asia. So that's the regional office for Eastern Europe and Central Asia for CDC. That includes 10 countries. So it's Georgia, Armenia, Azerbaijan, Moldova, and Ukraine, and then 5 Central Asian countries: Kazakhstan, Kyrgyzstan, Tajikistan, Turkmenistan, and Uzbekistan. So the idea being that these are former Soviet countries, and some of them are still working on those Soviet systems that may not be really um, able to manage public health threats of this day and age. So my passion is to build that kind of capacity and to influence systems through building that capacity for public health in these regions. So our regional office is based in Georgia, and I have a dual role. So I'm the regional advisor for workforce, where our focus is on institutional development, building partnerships with building local and national ownership as well as regional ownership of programs of including public health universities, actually. So we are trying to build a consortium where public health universities that actually produce public health professionals that eventually start working in the ministries of health actually have that capability. And then we continue providing support to them for their professional development once they are employed by the ministries of health. Um, so that is my goal, to build a strategy around it, to make sure that these people have career pathways, they get the required skills, and the government can actually respond to any public health threats. My second role here is the country director for Georgia. I'm in an acting role right now. So I manage the Georgia country office. So I was telling you there are these layers. So the Georgia country office has, of course, a much broader portfolio on all disease threats. So while workforce development is a core component of it, we help develop the National Public Health Institute here, which is equivalent to, like, you can think of a CDC for these countries. So it's the CDC of Georgia. We support them in their broad functions for multiple areas of, again, public health priorities. So we are under the chief of mission, which is the ambassador for U.S. Embassy. So we work very closely with other U.S. government agencies. And there are multiple issues, as you mentioned, in this region. There is a lot of mis and disinformation spread by other actors who are, not aligned with how we work. So there's a lot of complexity in working in this region, because even public health, for example, can be used as a tool to enhance this mis and disinformation. And now with, of course, the war in Ukraine, and Ukraine is one of our countries that we support. So we do have a country office in Ukraine, but from the regional office, again, I'm the workforce advisor for the regional office, which puts Ukraine's workforce portfolio also under my support. So through our regional office support, we are trying to ensure that the recovery, first of all, that Ukraine can continue these essential medical or public health services, but also we are focusing a lot on the recovery part of Ukraine. So as soon as the war stabilizes, that we continue to make sure that they have their public health systems intact, and the ones that do not are not intact can actually recover fairly quickly. Currently, this week itself, we have a training in field epidemiology, which is more applied epidemiology, and again, surveillance and identifying outbreaks, managing outbreaks, and things like this. And we have, it's a 5-country program, and we have Ukrainians participating in that program. So we are, and that is being held in Georgia, because we are able to bring them out of the country to train them, and they go back. I know mostly people hear about the, more of the military trainings, but
Right.
while those are happening, we concurrently are trying to make sure that the health trainings continue, and we continue to support those health systems. The easy answer is Pitt helped me gain the technical expertise. I did my PhD there, and I had public health education before that in medical school, as well as in my master's that I completed in Europe in multiple countries. And but I think what Pitt gave me was, of course, much more technical knowledge at a higher level. But what I always remember Pitt for is, while technical knowledge is great, I remember Pitt for more of like, and the people that I worked with, my mentors, my teachers, teaching me the work ethic, humility, collaboration, and some of those softer skills, management. And I think, I'm always grateful to my mentor, Dr. Ann Newman, who believed in my capabilities when I didn't myself know I had those capabilities, to ask me to lead and design programs that I initially refused. I said, I'm not sure I could do it. So, but she said, no, just do it. So, and why I'm telling this to you is because I think this is my advice to students is, this is the time to be bold. If you have, first of all, don't wait for opportunities, look for opportunities. When I first came to Pitt, I came like kind of off cycle and came in January. So there were not a lot of scholarships available. And I was actually planning to leave because it was too expensive and I just couldn't afford it. And but I started looking for opportunities, and eventually I actually had several opportunities. And the area that I eventually chose was not really at the top of my priority list based on the subject matter. So, but I connected with my mentor, with my future supervisor, and I understood there is more to being successful than just working on your subject matter, on your subject area. I think a lot of times people get stuck in, this is what I want to do and that's it. And I feel like being flexible, being open, being bold, being brave, in choosing options and agreeing to doing things is something that is done best when you're a student, because you can be forgiven. You are a student. So you are supposed to make mistakes and you learn from them. And as students, a lot of times we become very conservative, and we feel that, oh, we don't really have, as a student, I actually should not try new things and should go along this path because this is what's set for me. I think completely differently. And I run a lot of training programs here all over the world. And I tell my fellows and my residents that when you are a resident, when you are a fellow, be brave because you will be forgiven. You are learning. But when you are hired as a professional, it's very hard to get out of making mistakes. You can still get out, but it's harder. So this is my advice that we all know the hard work and the sincerity and all the other things are really important, but being flexible and jumping into things to just get it done and try it out is really, really important. I want to say to Dr. and Mrs. Sheth, I think again, thank you for giving this recognition, an opportunity to be part of this growing community. And as I mentioned earlier, again, it's such a motivation to know and to read about people like Dr. Sheth, how he actually again came as a student, as an international student, and how he grew and had a really diverse career and has a foundation that supports other students. I think this career that he has is a motivation to people like me who are still growing and who understand that there are lots of other levels that I still have to reach, and a constant example to follow. So thank you again for recognizing me and adding me to this community of people like you, as well as our other peers who have achieved great accolades and accomplishments throughout their career.